Spinal cord injuries may result from the direct trauma to the vertebra, to the ligaments, and to the discs of the vertebral column, as well as the direct trauma to the spinal column. So, this is basically a range of the trauma to the spinal cord, and we have to basically deal with all of these traumatologies whenever we are working in the field. And we have to know the consequences and the treatment modalities that are part and parcel of this game. So, whenever we are discussing these spinal injuries in detail, basically we are dealing with the concussions, we are dealing with the direct compression injuries that can be a part and parcel of the spinal injuries, and then there can be a pithing phenomena. Then we can have lacerations, which are a part of the violent spinal injuries we come across whenever there is a road traffic accident or any other wide range of traumas. So we can basically come across the hyperflexions and the hyperextensions. And lastly, we can also come across the spinal cord injuries, which are a result of the road traffic accidents. That basically includes the whiplash injuries. Now, the whiplash injuries are very important. And basically what happens is it's kind of a whiplash phenomena in which the person is, first of all, he goes into the hyperextension, and then after that he goes into the hyperflexion. So it's basically a whiplash phenomena, a back and forth phenomena that is observed especially in the cervical column, and it's quite dangerous for the person, especially for the people who are the front seat passengers, that is the driver and the person sitting next to him. They usually come across this whiplash phenomena, and that can be very damaging to the people who are traveling in that car. So it's basically this hyperextension. Now, the hyperextension is more dangerous and can be more damaging than the hyperflexion. So the injuries that are caused due to the hyperextension, that needs more rigorous treatment modalities rather than the hyperflexion. So we have to keep all these things in our mind. Now, the spinal injuries. Now, regarding the normal structures that are lying in the spine are basically over here. You can see these are the afferent sensory nerves over here. Then we have efferent signals that are coming from over here. And this is basically the spinal column. The inner surface, it's basically the gray matter which lies over here. Just to have an overview and just to revise all the anatomy in your minds, you have to go through this, and it's very helpful just to know what kind of trauma these spines can go through and what are the results for that trauma. So here we have the gray matter, then we have the white matter over here. Over here in this diagram, you can see the spinal nerves that are on this side, and then we have the dorsal root column, which is basically lying on the lateral surfaces of the spinal cord. And then over here, we have the anterior median fissure, which is basically carrying all these arteries and veins. So basically these nerves, these arteries and veins, and this gray and white matter, all of them are at stake whenever there is a trauma to the spine. So this is basically the mainstay to that, and the cervical part is most important. Why is it so important? Because it is the part that will go through that hyperextension and hyperflexion that I was talking about. So it's basically the most important and the most vulnerable portion that can go through this trauma. It is caused by the compressional, hyperflexion and the hyperextension stress that we'll go through. Now, the compression damage. When the victim falls from a height either onto his feet or his head, that will basically cause this compression. Compression is basically, as you can see in this diagram, this is basically the intervertebral space. Intervertebral space is simply the space between two vertebral bodies. So in between this space, a lot of nerves, a lot of arteries and veins are coming out and coming in just to communicate with the spinal column. So if there will be a compression of this intervertebral space, all these nerves and arteries will go through that compression phenomena, and that will be very traumatic to that artery and veins and nerves. A fall onto the head may also cause the burst atlas injury. So it's also known as the burst atlas injury, and it's basically the the atlantoaxial joint that is basically very important. And if that is fractured, even the paraplegia can be observed in such a patient with the atlantoaxial joint fractures at C6 and C7. That is the level. The C6 and C7 level is most vulnerable for this blast atlas injury. The posterior arch can also be fractured in such cases. And the compression fractures of the vertebral bodies are very important over here. If we have these compression fractures, then this can be very damaging and it can cause a severe trauma, and even paraplegia and quadriplegia can be observed in such patients. Now, the less chance of the spinal cord injury compared with the angulation injuries. So the angulation injuries are also very important, and they can be part and parcel of this. The hyperflexion and the hyperextension injuries, they're very important. For example, this diagram is explaining quite feasibly. For example, in this state, we see the cervical column over here. After the impact, it's going into the hyperextension phase. And over here, it's going into the complete hyperextension phase. And after that, there will be a hyperflexion. So this hyperextension and hyperflexion is basically known as the whiplash phenomena, because it is the back and forth phenomena. So what happens here is the hyperextension is more dangerous. You have to keep that in your mind. And the examples are, for example, in the frontal or the rearward motor vehicle crashes. There is a front impact of the motor vehicle, and what happens here is where a car undergoes the violent frontal deceleration. So there is a frontal impact, and so there will be a deceleration as the car is already moving. So if it hits, there will be a sudden deceleration. More accurately, it is known as a sudden deceleration. Now, then what will happen is that there will be a hyperextension, and then the person will go in the hyperflexion. And the most important part of the spine that will undergo that is the cervical spine. And that is the most damaging, the burst atlas phenomena that as I was already emphasizing on. When the vehicle is struck from the rear, even then there is a hyperextension and hyperflexion, but that will be of a more moderate type in that case. Now, again, we have another diagram which is representing this whiplash injury. The soft tissues are damaged, the direction of impact. So what are basically the injuries that a person can sustain in such a case are the torn anterior ligaments can be there, and the torn nuchal ligaments can be there, and it will take a lot of time to repair. Although the nerves and if there is any nerve damage, and if there is any arterial and the venous damage, that may take a bit longer, but these nuchal and the ligamental damage can be quite repaired in such cases. The whole range of lesions can follow, and the bleeding into the surrounding muscles basically start occurring. The rupture of the anterior longitudinal ligament happens, and the tearing of the intervertebral discs and the annulus fibrosus occurs. So this is basically a range of trauma that can occur in such whiplash injuries in the road traffic accidents. The nerve roots are torn or compressed. Then we have the spinal canals. They are narrowed and distorted or obliterated by fracture dislocations of the vertebrae. The compression, ischemia, hemorrhage, and pulping of the spinal cord is seen in such cases. Now, over here, there is another, this is basically a summarization of all of the spinal cord injuries that can be occurred in such cases. We can have the concussions, for example, if there is a direct rear impact injuries. Then we can have compressions. Compressions, as already discussed, is basically the narrowing of the space between the two vertebral bodies. That is basically known as the compression. They can be also a part of these trauma to the vertebral bodies. Then we can have pithing. So there can be sharp objects that can usually pith through these intervertebral discs, and that can be quite damaging to the spinal column. And then we can have lacerations. Lacerations are very important, and they're usually seen in violent traumas that are encountered in road traffic accidents, and that can be a part and parcel of these spinal cord injuries. So in this section, we dealt with different forms of spinal cord injuries that we come across. There are a lot of consequences to it. Quadriplegia and paraplegia are the mainstays to it. So we have to consider it, the treatment modalities and the type of patients that we come across. We have to know how to manage these patients. That was the end to this section. Thank you for watching sqadia.com.